So the next presentation is called Creating a Coordinated Community-Based Senior Serving Sector in Alberta. I'm very pleased to have Karen McDonald join us today from Edmonton. Karen's a colleague of mine on the Minister's Seniors Advisory Council. And Karen is the current Executive Director of the SAGE Seniors Association, a community-based senior serving organization in Edmonton that provides primary health care, social services, community development, and recreation services for seniors. She's one of 4 community service providers that has led the development of the first steps towards a community-based seniors serving sector in Alberta. So please join me in welcoming Karen McDonald. Karen?
Much like Sarah, when I got the note at 10:30 last night from Marlene that we were speaking this morning, I had a little moment of panic. And I thought, I'll have to drink lots of coffee, so I'm perky. And then I realized it meant that I didn't have to speak after Zena. And if you've ever heard her speak, you don't want to speak after her because she is fantastic. So I thought that was good news. And then I realized that, if you're speaking in the afternoon about community-based senior services, people might kind of doze off, might be a little sleepy, so maybe the morning would be better. And then I heard all the great questions for Sarah's presentation this morning, and I realized it's a whole room of my people. You guys are going to be right there with me on this topic, I can tell. So that's exciting. So thanks for having me here. As I mentioned, or as Mike mentioned in the introduction, I've been working on this with colleagues from 3 other organizations: Age Friendly Calgary, CARIA in Calgary as well, and then the Edmonton Seniors Coordinating Council. And this work has been undertaken in close partnership also with the Ministry of Seniors and Housing. My colleague Jazz that's here today has been working with us on this as well over the last year and a half or so. So a community-based senior serving organization may be a nonprofit agency such as a senior center or a community organization that provides social and recreational programs and or support services for seniors in their community. It could include the provision of senior services through a municipal agency as well, so Family Community Support Services here in Alberta. The supports and services provided by CBSS organizations improve health and social outcomes for older adults. This includes programs and supports that address affordable housing, health and wellness, social inclusion, access to affordable transportation, financial security, system navigation, nutrition and food security, physical activity, and many other services that are non-medical in nature, but crucial for healthy aging and community. We define healthy aging as a lifelong process of optimizing opportunities for physical, social, and mental wellness, continued independence and quality of life, and enhancing successful life course transitions. Healthy aging considers all aspects of a person's life, from physical and mental well-being to housing and financial security. So you already know all that, right? We're all on the same page. There we go. So, numerous organizations exist in community and serve seniors, but right now in Alberta, that work is often happening in silos. It can be quite fragmented. Often community organizations are competing for funding. There's an inconsistency in access and delivery of services. It can be very difficult in community to work systemically with other sectors, in particular with our colleagues in health. Currently, community services for seniors in Alberta doesn't really function as a sector per se. In order for us to address the increase in the population of seniors in Alberta, we're really going to need to think about transformational change and service delivery in community services. Community organizations are not currently being engaged systemically to address seniors' needs and strengths. So unlike other populations, whether it's children's services, addictions and mental health, newcomer supports, we do not currently systemically leverage community-based organizations to meet the health and social needs of seniors in Alberta. Currently, the primary ways that senior services in community are funded is through FCSS, which varies depending on the municipality, and then often those services are provided through systems like home care. This is a lost opportunity to leverage communities to support one another. Because the community services are not coordinated, other systems are often taking on the work that's traditionally been done in community. Today I'm going to talk a little bit about the work that's happened in British Columbia to create a community-based senior serving sector. They're about 5 years ahead of where we're at currently in our process here in Alberta. But one of the things that they've done is they've been able to, over those 5 years, really distill down what are community-based organizations particularly good at. And I wanted to share those three things with you because I think it kind of galvanizes what we're talking about today. Community organizations are particularly good at mobilizing communities, harnessing the capacity of residents to care for one another, and to be a voice for the diversity of seniors. So the first phase of this work, four organizations began the journey because there wasn't one organization in Alberta mandated to do this work. There's a bit of a gap there. There's no natural backbone to undertake the development of a community-based senior serving sector in Alberta. So I'm up here and these other three organizations, it's really a temporary role until we have some sort of leadership structure in place in Alberta. We approached our colleagues at the Ministry of Seniors and Housing and secured a grant to support this first phase of work. People across the province have participated in engagement sessions this past fall, and they're consistently excited and inspired by the potential of what's happening in British Columbia. So we're going to talk a bit about that. When we undertook our consultations in Alberta this past fall, sharing the story of what's happened in BC was like fuel on the fire. There is a readiness in Alberta across community, government, health systems, the public for this type of change. But being able to share a vision of what's possible in a province so close to our own was validating and galvanizing. So what did they do in BC? They really focused on a community development process, and they were able to coordinate a sector quite centrally. The goals of the creation of a community-based senior serving sector in BC mimic many of the goals we have here in Alberta. To maximize efficiencies, identify programs to reduce health system costs, to move from competition and fragmentation to enhance sustainability and consistency of community services, to build local, regional, and provincial networks and collaboration, and profiling and scaling promising practices. This work in BC began at a conference introducing the Seniors Advocate in 2015. At one of the workshops at the conference, delegates called for action to raise the profile and address the underfunding of community-based senior services across the province. In BC, CBSS is defined as all not-for-profit and municipal services, including senior centres, community centres, coalitions, and something they call neighbourhood houses. They received a seed grant to bring together a network of leaders from around the province working in community-based senior services, and the network agreed that CBSS organizations were isolated and competing at the exact moment when they should be coming together and speaking in a unified voice about the value of their services. Does that sound familiar right now in Alberta? In BC, the Ministry of Health and United Way recognize the value of supporting CBSS by funding the Raising the Profile project. So what was raised? The issues on the slide. So evidence-based articulation of the value of the work that happens in community organizations, equity and access to services, particularly in rural and remote locations, the need for a backbone and structures to support this work provincially and locally. And through this work in BC, some of the outcomes were that they developed a provincial network, they undertook a comprehensive literature review, they engaged in 7 community consultations across the province, with more than 400 stakeholders from urban, rural, and remote communities. They published a report on the findings and recommendations from the community consultations in 2017. And then in the fall of 2017, they had their first provincial summit on aging. Since that time, they meet every 2 years, and at that summit, that's where they set their priorities for the next 2 years. The discussions of the provincial infrastructure needed to support local communities resulted in the following: the creation of a hub for sharing resources and skills virtually, online. Ongoing support to build the capacity of local organizations to work collaboratively, develop local leadership, and demonstrate the value of the services they provide. So for example, they made high quality training for evaluation work, evaluation skills accessible to those community organizations. They increased access to ongoing and collaborative funding options. They increased the number of higher needs seniors seeking support from community-based organizations. They found that the greatest challenge was to develop ongoing and effective collaboration with the health system. They found that there was great importance in developing common language to bridge the gap between community organizations and health systems. They identified the value of reframing community-based senior services as the health prevention, health promotion arm of the Ministry of Health. They worked on removing the barriers related to income, ethnicity, race, and indigeneity. They recognized the diversity of the seniors population and hence the importance of providing person-centered services, and the importance of creating space for the most vulnerable older adults to engage and be heard. So what did they do in response to that What We Heard report? First, they created a definition of community-based senior services, and then they created a declaration. The declaration is an interesting thing because essentially any individual or community organization can be part of the community-based senior serving sector in BC simply by signing the declaration that they agree to the value of the work that happens in community and to the definition of CBSS. So it's not a membership-based approach, it's very much a network, and that's that community development approach that they mentioned earlier. The coordination of this work occurs through pretty extensive coordinated structure and governance models. The provincial backbone organization in BC is the United Way of the Lower Mainland. They have several different groups that come together regularly. The Healthy Aging Reference Group is comprised of provincial and national government representation and nonprofit organizations. There's also academia is represented at that table. The Municipal Caucus is local government officials, and these are often the community-based senior serving champions in their regions. There's a funders table. So imagine all the different levels of government, community foundations, United Ways across the province that are funding community-based senior services are now at a table together making strategic decisions about how to prioritize that investment. There are regional networks, provincial working groups that are topic-based, and there's an evaluation committee. One of the most exciting things that's emerged from the work in BC is the development of CORE. CORE is an acronym for Collaborative Online Resources and Education. So CORE is essentially a virtual hub for the coordination of the work that occurs in community in support of seniors. So community organizations have access to this virtual hub where there are virtual communities of practice where people can share emerging and best practices. All calls for funding for community services for seniors in BC goes through CORE online from all different funding opportunities. There's information about training opportunities for staff within these agencies. It's essentially a virtual capacity building and information sharing and coordination mechanism. The provincial working groups also emerged in different topic areas such as transportation, affordable housing, physical activity. So this work is ongoing in BC. Some of the very interesting programmatic things that have emerged is work around things like social prescribing in the Fraser Health Authority, which is a partnership between family doctors and community-based organizations. The Better at Home program is across the province. It coordinates those non-clinical supports that seniors need to stay in their homes for longer. Things like snow removal, yard maintenance, housekeeping, home baking, all those things that we know are very important to people's health and well-being. And then programs like the Therapeutic Activation Program for Seniors, or TAPS for short, and that's really around people's physical activity and well-being. Now let's turn back to Alberta and share a little bit about what's happening here. Good. Province-wide conversations have been undertaken this past fall with the goal of to validate the strengths and challenges for seniors for healthy aging in community across Alberta, to identify possible focal areas for cooperative, collaborative action by community-based senior serving organizations, to identify people and organizations who wish to help champion and lead this journey in Alberta. The engagement sessions are now wrapped up. We're in the process of reporting back to all interesting groups later this month with the What We Heard report. This work is really the foundation for our next steps as a collective or as a network provincially. In the first phase of work, we really focused on building trusting relationships across community organizations. Community organizations in Alberta, often we've never even met each other. I've been working in senior services for 20 years, and when I was out doing those engagement sessions, it was rooms full of people I'd never met when I was in northern Alberta. So we need to be able to build those trusting relationships, because when we're talking about systemic change, we will rely on those relationships as the foundation. We have to invest in this community development approach if this work is to be sustained and fully realized. But we now have information about where people are willing to invest their time and energy. So the natures of the sessions, we framed them as the first steps in the process. There was 24 sessions in Alberta. There was 2 telephone town halls for people who couldn't attend in person. So nearly 180 people participated. We missed a lot of people, but we know that this was an important first step. So we have a couple quotes from participants here. I'll just read them for the people in the back. Quote, "The idea of having a voice as a volunteer in a very small community is very encouraging to me." That was a session participant in Grand Prairie. "I'm excited about this conversation and the possibilities. The challenge will be in the details and in the sustainability of the model." That was someone in Edmonton. "And I enjoyed the opportunity to connect and be part of the future of community senior support." That was a program participant in Fort McMurray. So what are we hearing here in Alberta? We know that there's importance in creating structure around a community-based senior serving sector. We'll need to determine in the Alberta context what that leadership and backbone role looks like. What are the roles and responsibilities of those different tables that I mentioned from BC? What resources will be required? There's a real focus on the importance of navigation and service mapping. So services and organizations working together more closely, working collaboratively to support older adults more effectively. People felt it was very important to understand what is currently in place, and that is a condition that's needed for future action. In some conversations, the outcome achieved through a sectoral approach was a common understanding of service pathways and the abilities for seniors to more effectively access supports and services. So service navigation will be increased as the result of a creation of a sector. That was the hope and dream. Resource sharing and knowledge exchange. There currently isn't really a way to share information about best or promising practices, so people were excited about that opportunity. Things like training materials, reduction in competition for funding through information sharing, and building of trusting relationships that lead to collaboration. There was a hope that through this work there would be an impact on funding and the sustainability of services that support seniors to age in community. People felt very strongly that we need to be sure that community is driving the change, that we have a shared evaluation framework and the identification of key outcomes provincially, and that we have improved data and information for policy making and program development. People are also focused on the need for increased services and supports for aging in place. They felt that a stronger sector will result in better service and outcomes for seniors. Seniors will be more effectively supported to age in place. Participants identified that the creation of the sector would have an impact on the quality, level, range, and coordination of services for seniors. As one participant identified, all potential outcomes would be the opposite of the challenges that we have talked about in today's session. Participants raised improved benefit for seniors as a general outcome resulting from the creation of the sector, but also identified specific service areas where they anticipated results. So for example, improved transportation services, reduction in isolation, and increased access to respite care were things that were identified. The benefits for seniors were also extended in some cases to the importance of supporting families and caregivers and service providers, as well as seniors themselves. And at the end of the day, what we heard is that people want to understand how this work is going to directly impact the seniors they serve. So that's why people work in community with this population, right? They want to see the impact of the work they're having. Through that work, we were able to identify some key principles that people felt were critical for success moving forward. They said that organizations that make up the community-based senior serving sector in Alberta are experts in the work and the communities, in their work and their communities. And this community knowledge and wisdom is recognized and valued in this work going forward. That there are different geographical needs and experiences across the province. Diverse geographical representation is needed and must be considered in next steps. There is a need to balance both provincial and local community-based perspectives. People emphasize that seniors are unique, contributing members of the community, and their voice must be heard and reflected in the next steps and related programs and services. People emphasize that there's excellent work going on in the province and that sharing and learning by leveraging that existing work, tools, and research is important. People reminded us not to assume a common understanding of key terms. For example, it is recognized that CBSS organizations may be private, public, or nonprofit, and focus on a variety of areas such as housing, health, social services, and recreation. Therefore, inclusive definitions and processes must be used in this work. There's a need to simplify and streamline funding and evaluation as well as reporting systems. The current fragmentation and complexity of these systems takes time and attention away from frontline service delivery. People reminded us that the seniors population is complex and diverse. Equitable service access for all is needed. This requires equitable funding for community-based seniors organizations across the province. Broad-based approaches need to be considered, so things like intergenerational programs and services, it can't just be about senior services. And next steps must mobilize action and sustain momentum. Organizations want to see results in the advancement of this work. People said things like, please stop consulting us. So, next step. So we're in the process of, we're just doing the graphic design work on the What We Heard report, so we will do our best to make sure that everybody has access to that across the province. That report will include as well a proposed high-level roadmap driven by the community organizations, and the need to create an interim leadership council. So that's one of the most important next steps. Balancing the need to capitalize on the momentum and the alignment of priorities in the province with the need to respect a community development approach, which tends to be a bit slower and messier. We also recognize that we need to balance some of the structural or governance structures with the need for systemic and programmatic initiatives so that people feel that sense of momentum. And people also were quite excited to really rally around the idea of that virtual hub, the core platform that we talked about, and how that might apply here in Alberta, as well as leveraging the work that's happening right now in Alberta with bringing 211 across the province. So I was happy to hear that we might be aligned in that area as well. So that's the high-level summary of what's been happening. I'd be happy to take some questions.